Good afternoon. I'm going to tell you something about what we do in our practice that's different. We work a lot with ozone in our practice. Ozone is a gas that's made out of oxygen. So basically, you take an oxygen tank and feed a tube from that tank into a machine that will convert oxygen into ozone. Ozone itself is very powerful. It kills bacteria, it kills viruses, it kills parasites. So EBOO, this guy, is the most recent development that we work with. EBOO is E, B as in boy, O, which stands for extracorporeal, out of the body, blood, ozone, and oxygen. So the procedure itself involves putting a needle in a person's arm, and blood comes out through that needle through a tubing into this machine where there's a dialyzer. The dialyzer is another device that has a membrane in it. On one side of the membrane is your blood. On the other side of the membrane is ozone and oxygen. And the ozone and oxygen will pass through the membrane into your blood and turn it bright red. And then that comes out of the dialyzer through another tubing into your other arm. So there's a circuit that goes from your right arm into your left or left arm into your right. And that goes on for about an hour. So you have this continuous exchange of ozone and oxygen into your blood through this device, and it can really help with inflammatory conditions. People who have post-viral problems where they remain fatigued for weeks or months afterward. People who've had pneumonia, people who've had surgery done, and they just can't recover from it. This can really help them, and it will also help handle other problems, like if you're trying to detoxify from something that you were doing or taking or given, like a medication or from alcohol or from drugs. This will help the remnants of those things get out of your system. Well, if you're interested in EBOO, give our office a call. We can talk to you about it on the phone, or we could have you come in and discuss it. We want to know what the problems are, and we can tell you whether we think that EBOO will be the right answer for them. A lot of times it is. Sometimes other things are also necessary. But this is a very good choice for a lot of difficult problems people have. Rather than taking drugs or being able to do nothing about it, the EBOO can be quite effective. Thank you for listening.